Good morning, everyone, as well, and welcome. Let me join Ann in welcoming all of you here, and also those of you that are on our broadcast. I'm the clinical professor of global public health at New York University, and also the president of the International Society for Urban Health, and a member of this, co-chair of this forum with my colleague Clarion Johnson, who you'll see on day 2. This is a 2-day program. We're very excited about it. I do want to acknowledge, first of all, the planning committee who put this together. I think their names were up before. Maybe, I don't know if we can go back to that. Told I could go back, it didn't work. Who are Ann and Christian Achema from Uganda, Simon Bland, UN AIDS, Alison Goldberg from ABM Bev, Clarion Johnson, Rebecca Martin, William Bill Rouse from the NAE, Sean Standridge, and David Vlahoff. And so we thank them very much. They've been working on the telephones and in helping us identify the fantastic speakers and putting the sessions together, so we really appreciate their work. We're hoping to design this so that the presentations, instructions we've given, our folks are a little bit brief, and then we hope to have a lot of active questions and answers from those of you that are here in the audience. My job was really to explain this workshop and why we're doing it, and I thought in the spirit of a picture is worth 1,000 words, I would just give you a very brief answer to that question by really looking at the issue of cities really as drivers of global health. So why cities? One of the issues is that over half the world lives there. There's a bit of maybe a debate about which year that crossover happened, but many say in 2007. And the point of it is that urbanization is a global issue. It's not just in high-income countries. The most rapid growth in cities is in so-called smaller cities, sometimes called secondary cities, between the size of 250 and 500,000. And we hear a lot about the mega cities, but there are also other cities where there are great opportunities to promote health. As I said, this is a global issue. Rapid urbanization is the slope on that higher. The top grid represents the rate of growth in low-income countries, less developed countries, and you can see that while, as some say, the high-income countries have become rich before they've urbanized or had older populations, the low-income countries are urbanizing very quickly. And so while cities are very often, certainly the economic engines of the globe and often drive the culture, arts, innovation, and business in a given society, sometimes because they have greater links to global communication or trade or culture, they also consume more than the majority of the energy, generate the majority of waste, both solid waste as well as air pollution. And you can see that why we say what happens in cities really affects the state of global health and the ability to meet global health goals and the SDGs. Now, why are cities have become extremely interesting for people to work in? Some of it is because the SDGs really acknowledged the existence of cities and the need to work subnationally, which is unusual for international organizations. And many are finding mayors very interesting to work with. They're very close to the ground. They have close relationships with those leading the agencies in their governments, with the civil society organizations, businesses located in those cities. And we see consortia of cities ranging from the C40, which has been very active in the climate change conversations, to compacts for national compacts on overall environmental issues, age-friendly cities, and healthy cities networks throughout the world. So this is an area that we think offers a lot of opportunities for change, and many companies, as you'll see in the next couple of days, are already working with cities, with leaders in cities, to address the issue of prevention, especially of non-communicable diseases. So working with the broader environments in cities is really a paradigm shift for the health sector. Traditionally, the focus in health sector has been on the personal health care delivery system, the list on the left looking at important issues like health system strengthening, healthcare workforce, the provision of essential medicines. And by introducing this broader notion of intersectoral engagement, working with other agencies, we open up the possibility of looking at the role of urban planning, transportation, housing, and economic development as really important forces for health, perhaps even more important forces than the health sector. This is a diagram we like to use at the International Society, saying that essentially all of these sectors need to work with that orange one on the left to create the conditions for health in cities and to complement the work of clinicians. So one of the important issues that clinicians recognize is you can care for individuals when they come to you, but you send them back into the same conditions and communities from which they came, the problem will not, cannot be improved. So this approach, looking at these different sectors, both government agencies as well as their partners in civil society, academia, and business, is often called the health in all policies approach. It was originated by the Finns over 30 years ago, really looking at the impact of other sectors on health. And the key points here really are that the health and well-being of all citizens is essential for overall social and economic development, that government policies have an impact, positive or negative, on the determinants of health in all sectors, and that in order to improve health, one needs these intersectoral partnerships across agencies and across government, civil society, and business. So with that introduction, we will start our session this morning putting urban health into the context of planetary health, which is a concern of everyone. And I'm going to introduce on videotape Sir Andy Haynes, who was Dean and Director of the London School of Hygiene and Tropical Medicine until October 2010. He's currently a professor at the School in Environmental Change and Public Health, and he chaired the Rockefeller Commission report on planetary health and has really been a leader in looking at how the planetary health concept can be unifying to bring all of those of us concerned in health to the table. And also we've asked him to address specifically the role of cities in achieving planetary health. So we'll have Dr. Haynes address us on video.